Welcome to our online seminar for bariatric surgery at Delray Medical Center. I am Dr. Erica Podolsky. I'm the medical director here of the program. I'm proud to announce that we're nationally accredited for excellence in bariatric surgery.
Well, hello. My name is Dr. Delray Rodriguez. I'm a bariatric surgeon here at Delray Medical Center, que es un programa reconocido nacionalmente como de excelencia en cirugía bariátrica, y queremos tomar esta oportunidad para introducir nuestro programa y darle un poquito de información sobre el proceso de cirugía para la obesidad.
So with bariatric surgery and obesity as a disease, we're not talking about people that are slightly overweight. Those people still can lose weight meaningfully with diet and exercise.
Obesity continues to be one of the main problems in our health system. It's becoming a pandemic and is the #1 preventable cause of death.
There are other comorbidities, hypertension, high cholesterol, reflux, migraines, a lot of inflammatory conditions, a lot of under-recognized conditions such as infertility. It's also a precursor to cancer. In talking about risk, we're talking about a wide variety of patients, and some people have waited probably way too long to think about undergoing bariatric surgery. And the idea for us is really to reach the community and find people that are wanting to be preventative in their healthcare. Right now, our current criteria is a patient who has a BMI, which is a height-weight ratio, of 35 with comorbidities, or 40 or above without comorbidities.
For most people, they're gonna lose about 50 to 80% of the weight that they're over their ideal weight, which for most people is somewhere around 80 to 100 pounds, depending on their starting point. Depending on the procedure, the sleeve or the gastric bypass, and also how well the patients follow the instructions and adhere to the follow-up in our support group.
What we encourage is staying with the program, staying with the support group, certainly following up with a nutritionist, and staying on track with the program. A lot of people start exercise programs and your body composition may change. So in the long run, it's not necessarily a weight number, but a feeling about how your clothes are fitting and how strong you are and how good you feel about yourself. Our program is a comprehensive program, both for metabolic surgeries and revisional surgeries. Our surgeries are approached in a minimally invasive way with laparoscopy and robotic surgery. We have state-of-the-art equipment at Delray, both in the operating room and in the hospital.
So in our program, we offer the two main bariatric procedures, with the first one being the sleeve gastrectomy, which basically we divide the stomach into making a smaller stomach that allows less food in it and allows you to be satisfied a lot faster, and you're not as hungry as much. This procedure is very safe. It's done laparoscopically. It's one of the most commonly performed procedures, and it's very effective in weight loss. The second procedure is the gastric bypass, in which we basically make a smaller pouch out of your stomach, and then we reroute how the food goes through your body. This allows for not a lot of food to be allowed in the stomach, and not everything that is eaten is absorbed. This creates a lot of metabolic changes, and this is the main mechanism by which the diabetes and the hypertension gets resolved after the weight loss surgery process.
So we've designed a concierge-style program so that there's support from start to finish. Once patients are seen, they meet with a nutritionist and psychologist, and once we decide on the proper surgery and preoperative testing, you come into Delray Medical Center, and the surgeries both take around an hour. After recovery, you have a private room with a private bathroom and dedicated support staff, which we think is very important in the program. Typically, patients stay one night in the hospital to ensure they're adequately hydrated before they go home, and then work through a diet which initially is a lot of high protein liquids and then transitions back really to a healthy eating style with high protein spaced meals, small portions, but certainly not portions that you can't go and socialize with your friends or go out to dinner at restaurants. Risk for the procedure is very low in comparison to some of the most common procedures we do, such as gallbladder surgery or hip replacement surgery. The risk profile is actually lower than those surgeries.
Well, these procedures, like any other procedures, have some risk or things that can go wrong, including bleeding and infection. However, specific to bariatric surgery, the one thing that we worry about are leaks, which is where the staple lines or the seams that we use can become loose. However, the chances of this happening are very, very low, and we take very special care to try to avoid those during surgery. So one of the concerns about our patients is how they're going to be able to afford these procedures.
So along with educating our community, we've also worked in our societies to educate insurance companies, and that's always been a struggle for us in the bariatric world. A lot of people don't have coverage for surgery. It's important, if you do have a commercial insurance, to ask if you have the benefit or if you can re-enroll with the benefit. There's always a self-pay option, which at Delray we try to make as affordable as we can. There's also Medicare, which is very common in our community, and Medicare actually is the easiest insurance right now, which hopefully will prompt the other insurances to follow along. Thank you for spending some time with us today. We're excited to help you in your journey. We have resources like our support groups that are open to the public that anyone can attend, friends and family, and gain more information about pre- and post-operative patients. We have a full-time nutritionist who's available to start you on your weight loss goals. We have a bariatric nurse who's also available for any questions. I'm happy to see anyone in the office. Our information is readily available on the website. We also have a Facebook page that we're continually updating, so it's great to check back in if it's something you're thinking about now and not quite ready. We'll be a program here at Delray for years to come, and we're excited to help everybody in their journey.